Create some obstacles. Here today to talk about how to stay safe and active and injury-free this winter is Dr. Alan Resnick, a board-certified orthopedic surgeon at Connecticut Orthopedic Institute. Doctor, welcome back.
Thank you for having me.
So what are the most common winter injuries that you see?
Well, the winter brings a lot of new challenges every year, and the most common things are the things people talk about frequently is black ice and slips and falls. And I think that's the easiest thing to talk about right off the bat. You can't see black ice, you fall down, people twist their ankle, their wrist, their shoulder, and their wrist fractures and ankle fractures are common. Other things that we forget about is the winter sports, and the more common injuries from the winter sports are skiing, ice skating, and snowboarding, and those injuries are also very common. You fall from a snowboard, people tend to hurt their elbow. Skiing, we think about knee injuries when they twist and the bindings don't release, and ice skating, obviously, we also think about ankle and elbow and wrist injuries as well. The last thing that's common in the sports part of the winter, which we don't pay much attention to, but is pretty significant in my practice, is indoor soccer. People go inside and play soccer and don't realize the conditions are different. We're on AstroTurf and concrete surfaces underneath, and there are a lot of foot, ankle, and knee injuries on those surfaces that don't happen in the summer.
All right, what should people be mindful of when they're exercising in the cold weather?
Well, of course, it's important to address appropriately and pay attention to the wind chill. As the weather report talks about that a lot, but it is an important factor. So I like people to really think about what they're wearing. If it's very cold, thermal underwear is helpful. Face covering is important. And people don't also realize they lose 30% of their heat from their head, so a simple hat will really make a big difference. And sometimes regular gloves that our fingers are separated, your fingers will get cold more quickly, whereas a mitten you might do better in a very cold condition because your fingers are all together and stay warm. And of course, we have to worry about frostbite.
All right, how does running in the winter contribute to knee or joint problems?
So the couple of things that are a little different in the winter. The first thing, and people also underappreciate, is the surfaces are much harder. So asphalt is a little softer in the summer. If it's 100 degrees out, the asphalt's quite soft. But when it's 30 degrees out, the asphalt is quite hard. So the surface is a bit harder. And the second part of that is your sneaker, which is normally very cushiony when you run, becomes hard rapidly in the cold weather. So if your sneaker is hard and the asphalt's hard, it's like running on rocks and stones. And people who tend to have arthritic conditions or injuries that pre-existed, they tend to see more knee and joint and ankle symptoms on the harder surfaces. They don't appreciate that it's the sneaker wear and the hard surface that they're running on that's causing that.
All right, Dr. Alan Resnick, thank you very much.